Welcome to the Wild and Fierce podcast. We are your hosts, Amber
and Johanna. We're here to explore womanhood through real, raw, and unfiltered conversations.
Please remember this podcast is for education only and not a substitute for medical advice. Always consult your own healthcare professional.
Let's dive in. All right, welcome back to the Wild and Fierce podcast. Today we're diving into one of the most transformational and misunderstood experiences in a woman's life, which is birth. If you've ever felt fear around giving birth, wondered about options beyond a hospital setting, or just want to feel more confident in your ability to birth, this episode is for you. We're joined by Miri, a home birth and birth center midwife who has helped countless women reclaim their power in pregnancy and birth. We're breaking down why birth doesn't have to be scary, the truth about physiological birth, different birth options, how to prepare, and what you need to know about medical intervention so you can be empowered with making decisions. Because here's the truth. Women are powerful. And when we take time to understand our bodies, our rights, our choices, we step into one of the most powerful experiences of our lives. So let's go ahead and dive in. Oh, I do want to do a quick disclaimer. Please, please, please remember, Miri is a midwife. She's not your midwife. I'm a nutritionist. I'm not your nutritionist. Amber is a personal trainer. She's not your personal trainer. So everything that we're talking about today, take it with a grain of salt. Talk to your own care team before making any changes. And none of this is medical advice. It's for education and entertainment purposes only. So let's go ahead, Miri. Let's go ahead and have you introduce yourself. Who are you? And then what led you to become a midwife?
Yeah, so I have been in the birth world for like 7 years now, and I kind of always wanted to be a midwife since I was a little girl. I had this amazing community midwife that delivered some of my siblings, and then she also delivered like my aunt's kiddos down the road. And so, I grew up in England, and midwifery care is the standard there. We would never see a doctor unless something came up that was more complicated. So I was just very used to my aunts and all the women in my life going to midwives for their babies. And so they were like a big pillar of the society. It was very respected. If you told someone you were a midwife in the UK, you'd get like a lot of respect for it. It would be like the same. I'm trying to think of a similar USA, like when you tell people you're a nurse in the USA, people are very like, wow, that's a really important job. When I tell people I'm a midwife over here, people don't really know what I do.
Yeah.
So it's like they keep asking like, oh, are you a nurse or what? They don't really understand what I do. So the culture in the UK is very different. So I kind of knew when I was about 7 that I wanted to be a midwife. I really looked up to our community midwife. I remember my mother got mastitis like maybe a week after having my brother, and the midwife came to our house and did a load of laundry and helped, and like that was just normal for us to have that type of care. It was, under the National Health Service system, which I know it's gone really downhill since back in the day. It's had a lot of strain on it, and midwives are having a lot of issues in the UK now. But what I experienced was women that really cared and were serving other women in their homes, wherever they needed to go. I don't know if you guys watch Call the Midwife, but it was very much.
That's actually the only thing the only way that I had heard of a midwife before.
Okay.
Is like, I grew up in a small town. I didn't know of midwives. I was born in a hospital. I thought that women just go to the hospital for birth.
Yeah.
So I had never heard of midwifery until a show called Call the Midwife. And then even then, I didn't ever really experience anything with midwife until I moved to Spokane, which was just a few years ago, which is kind of crazy.
Yeah, so that show really embodies everything that midwifery is over there, or used to be. I know that there's a lot of changes that's happened, but they still wear the similar like blue dresses and stuff.
Oh, no way. Oh, that's cool.
I love that.
It's like a very similar uniform, just slightly more modern. And I just envisioned myself in that uniform riding around on my bike, like in the country. Like people are like, oh, what part of London did you grow up in? And I'm like, oh, I didn't grow up anywhere near the city. I lived in a rural little tiny town in Lincolnshire. So it was all like cows and fields, and very rarely went to London or really any big city. So in my mind, like I was going to be this rural community midwife.
That's so cute.
And I was going to wear a little blue dress and go deliver babies.
We need to get you a little blue dress to start wearing on like Halloween.
So that was my kind of plan. My other kind of plan was that I was going to be a professional dancer. I also did ballet. ADHD brain, I also dabbled in professional horse riding and jumping, and like, so I had all these things going on as a kid, but the one thing my parents were like, you have to choose, like you can't be in everything at once. And so I did end up choosing more sciencey stuff, and then I went more down the route of dance because I love that. So we immigrated to the USA, my mom remarried and my stepdad's American, but we moved over here when I was about 15, and the culture shock was so intense. I was probably clinically depressed for 2 years. And it was just like, I didn't know where my life was going to go, because when I started to look into colleges for midwifery and I would tell people I wanted to be a midwife, I was just left with blank stares, and and they were like, oh, you want to be a nurse? And I'm like, no, not really. So in the UK, you don't have to have a nursing degree to become a midwife.
Okay.
And so you can specialize very quickly out of school.
Can I ask a quick question? Midwives in the UK at that time and then now, did a lot of them do home births, or were they at birth centers or hospital then? And then what is it like now? Do you know?
I don't know what it's like now, but I do know that when when I was a teenager, because we were rural, we would go down to the GP's office, like general practitioner, and they'd confirm pregnancy and everything, and they'd book you in with the community midwife. And if you were low risk, you had the option to either do a home birth or do one at like the hospital. And it would be the same midwife, whichever kind you chose. It would be the same midwife team for that like county and area and that village. So yeah, you could kind of choose either or. And my mom had 2 hospital births before she decided to do home birth, and she had not so great experiences with those. And so she was like, yeah, I just feel more comfortable in my house. And so then she had home births with the rest. But yeah, it would have been the same midwives and the options were the same. So you could just go down to your doctor and be like, yeah, I want to do a home birth or a hospital.
And it's very accepted.
Yeah, oh, absolutely. I don't know if it's still that way. It was for me, and yeah, it was cool. They come do home visits all the time. I know home visits are still a thing over there. So we have like these health visitors, and I feel like in the USA that would be like, oh, I don't want someone from the government in my house, But our health visitor was a family to us. Like she would come and do well baby checks and stuff, and she would come to the house and hang out with us, have cups of tea. We loved her. Like she was an awesome person, and also another role model I had growing up. She really cared about moms and advocating for moms. So there was a lot of in your house, in the community type of care that is still around. I don't know if I just got the really good side of it, but yeah.
That's what like actually mattered to have a village back then. The villages actually existed.
Yeah, the village existed very much. And I think the NHS hasn't poured enough money into that anymore. So I think midwives are not being really underpaid. They're super understaffed over there. So I think there's a lot of difficulties with the system now. But from what I experienced, it really was amazing care.
Yeah, very cool.
So yeah, so long story short, I just needed a job, and I was briefly homeless and just needed to make money at like early 20s, and I applied for a job at PetSmart and became a dog groomer because I loved pets and I loved animals, and so like I had that background with horses and everything. And I worked my way up the ranks, became salon manager. That was my career for like 7 years. I was a pet stylist. So that's a weird kind of background into midwifery. But then when I had my own child, it kind of really awoke that like desire to be a midwife. And I I was like, okay, I don't really have the money to go back to school right now. Don't really know what the paths and options are. So then I became a doula and kind of got into the birth world. And then from there, I kind of I was a doula for a few years, and people were just like, you are a born midwife. Like, this is what your heart wants. You just need to do it. And so the first place I applied for, I got in right away, and yeah, started school, and yeah, that's kind of my story.
How long is midwifery school?
Well, it so depends on
Yeah.
like, what state you're in and what their laws are surrounding midwifery. The PEP process, which is like direct entry midwifery, which is just apprenticeship model. You don't have to have any formal schooling, is an accepted in all states. It is in Idaho. Washington has a little bit more, some more requirements to the PEP process. You can get licensed in Washington through the PEP process, but it's a little bit more like you have to do extra births and take some extra college credits. So there's that option, which is 2 years, depending on how you have to basically have 2 years worth of clinical experience. And then you can apply to sit for your NARM, which is like the big exam. And then you get your certified professional midwife, and then you apply for the license in the state. So, yeah, to me, it's a little bit sketch. Like the fact that you can do 2 years of hanging out with one midwife who may or may not be a great midwife, and then go out and be serving families is a little wild to me. I know people have done it. I think that there's a time and place for PEP. Like for me, I have a a birth assistant who has been an RN for years. She has a ton of clinical experience, and she has been going to births as a birth assistant with a bunch of different midwives in the area. So she's seen a lot of different things and different ways of practicing. And she's already been to like probably over 100 births, and she would be a great candidate for the PEP process, but just because of her background and her experience. But I think kids that are literally coming out of school, like high school, and doing the PEP process freaks me out a little bit because they don't have a lot of knowledge. And there's no formal schooling happening. It's just, they may or may not come out of that process a competent midwife because it depends on who they preceptor with.
Yeah.
So that's kind of that route. And then there's the route I took, which was a bachelor's degree. So I went through a formal schooling. It was a 4-year program, but I did it in 3 years because I didn't want to be in school that long. So I doubled up my last year. And then same kind of clinical thing. You have to do at least 2 years of clinicals with a preceptor. And I had about 6 or 7 preceptors. And that was really eye-opening. And then there's the certified nurse midwife route, which is where you go and get a nursing degree, and then you go back to school and specialize in midwifery and get a master's. So and typically all you're learning as a CNM is generally in the hospital. So yeah, one is very long and very expensive, the CNM route. One is kind of in between, and the other one's like fast and quick. And
yeah.
So, and they all have very different philosophies and scopes of practice and different. In America, the CNM is recognized in every state, but
Okay.
CPMs are kind of state to state.
Okay. And the CPM is the one where they're coming from more experience versus a degree.
So yeah, CPM is like the apprenticeship model.
Okay.
They may or may not have done formal schooling.
Okay.
So they could have a bachelor's degree like what I did. But they could also have just done the PEP process.
Gotcha. Okay, cool. A big goal of ours for this podcast, and as I said in the intro, was to kind of talk about birth. I know I have a lot of girlfriends right now that are pregnant, and you focus on getting pregnant, and yay, we're pregnant, and then you're like, oh shit, I have to deliver a baby. Yeah, like I just had a friend text me and she was like, yeah, it just hit me. She's 27. She's like, it just hit me. Like I have to actually get this baby out of me now. And I really think that our society, we don't talk about things a lot, and we're going to get into all of this, but there's not a ton of education. Like most of us don't even know what a midwife is. Most of us think that doulas and midwives are the same thing, which I do want to talk about that in a moment. Um, and I think there's a lot of fear around birth, and we'll talk about that too. But before we dive into that, what is something that you really wish women knew? Like it was more broadly known, and I'm talking more specifically in the US, like broadly known about birth and like mindset around birth or just like thought process around birth.
Yeah, I think options. Like I see so many women just like crowdsourcing information, and the majority of people are going to say, well, I went to this doctor and I had a great experience. It's this OBGYN down the road. And some people choose their doctors because they just have a friend that was like, oh, well, I went here. You're just newly pregnant and you just don't really know where to go. And so you just kind of fall into OB care just by default because that's where most people are going. And it's not really a thought out process of what type of care do I want. And so I just wish people knew that there were more options out there, that they could research different types of providers. Like a lot of people don't know that your family doctor can even, some of family doctors can be your like OB, like you don't have to go to an OBGYN. And so they don't necessarily do C-sections, some family doctors, but they can be great, pregnancy support and stuff. So yeah, I wish that people just knew that there were more options out there and that they had the ability to change providers. I think that's a big thing too, is that once you're with a provider, people feel like, oh, this is kind of what I have to do now, just that's where I am. So yeah.
I think that part's huge, and that's something I talk with my own clients about being able to choose and change providers. I think there's a part of us that feels like we almost owe that provider something, like, oh, they took the time to have an appointment with me, like I owe them to stay. And when I tell clients if they're not vibing with their provider, I'm like, fire them. And they're like, what? I'm like, you don't owe them anything. This is your birth and your experience, not theirs.
Yeah.
Go find someone that vibes with you.
I see it all the time on social media, like people telling me I had to be induced. I had to go to the hospital. I was like, did someone show up at your door and put you in the car? Like,
Yeah.
you don't have to do anything. Like, but people don't realize that. And so I also wish that people knew that they had autonomy in their care. And I think it kind of goes back to just how women are raised, just to not really know that they are, and I know you guys know a lot about this, not to trust their own bodies, not to trust their own intuition, and to look to a different authority to know what they should be doing, and that like good girl persona, like I want to check the boxes. And I think this happens like from very young, like we're trying to tick boxes and do everything correctly and get the pat on the head. And I see women falling into that a lot, even as grown adults wanting to do the right thing and do things by the book. And rather than kind of like looking inwards and being like, what do I want? Like, and that people pleasing plays a lot into like people not wanting to change providers because they're like wanting to, the perception of themselves is a big deal to them. I'm a recovering people pleaser, so
me too.
I will have that place process.
Yeah,
I love it.
I think also in the medical system or standard care, a lot of things can feel very emergent as well. So like if you're told you have to be induced, a lot of women are like a lot of the time it's like you have to be induced by 6 p.m. tonight or whatever it is. And there's like no, do you want to go home and think about this? There's no anything like that. So there's not a lot of the other, it's like one, women are people pleasing and they're not encouraged to take ownership of their decisions and they don't feel like they can take ownership of their decisions. And then two, there's also that external pressure of like, no, you have to make this decision right now. Otherwise your baby might die or, C-section might happen or whatever it is. Which I think is a tricky aspect to a lot of this too.
Yeah, it's also just like a lack of feeling like they have choices in anything in their care. Doctors are very used to telling people what to do, and that's fine. I feel like half my clinic day is trying to retrain people to realize that they're the ones deciding everything, their boss, and I'm just there to provide information. I'm not there to tell them what to do. And for some people, that's really scary. So a lot of times I get nurses and stuff messaging me and saying, we wished people came in with questions and had the thought process of had done childbirth education and had educated themselves, but they just come in, they sit down on the bed and they look at them and they're like, what do I do? And so the nurses have to take that role of telling people what to do. The doctors are used to needing to take that role as well. So it is very ingrained in the medical system, and it's hard to get out of, even as a patient. A lot of my clients look at me like I have two heads when I'm like, here's this information, what do you want to do? And they're like, well, what should I do? And I'm like, it's all yeah, like honestly. And some people would prefer me to just be like, this is what you should do. And in that case, I'm not the provider for them.
I think this is why all three of us, like our businesses have very similar foundations around education and client empowerment. And the education empowers them to make decisions for themselves. We're like guiding, keeping them on the railroad track, so they don't fall off. But like we're giving them the tools to make decisions on their own.
Yeah.
I'm not going to go and be like, in their house, this is the exact workout you need to do, or this is the exact food you need to eat, or whatever. We're giving them the tools to then make decisions by themselves, which I think is what a lot of people don't know is a thing.
Yeah, they're not used to it. So
No.
it's foreign and can feel a little scary when you're suddenly the person controlling where we're going. And we're trusting you to do that. A lot of people have never felt trusted to make their own choices. And I always talk about this. You have to take a newborn baby home and make decisions for them for the rest of their, like till they're 18. You are trusted to do that. You need to start thinking about that. Even preconception, you need to start thinking about the fact that you are going to have to feel confident to make decisions for your family. And so we start training for that in prenatals, because then when they go home with that new baby, they're not as overwhelmed. I feel like postpartum depression is so much like, whoa, I was just given a new baby and told to go home. And I've had nurses and doctors tell me what to do this entire time. And now I'm just home alone and I have no idea. I've not been trusted to make my own decisions. And so there's like a lot of fear that postpartum moms feel. And I feel like I see that a lot less when we start from the beginning of prenatals, trusting women to make choices for themselves.
For
I
sure.
love that so much.
Yeah, absolutely. Well, and I've had friends say that to me, like, oh yeah, and then you deliver the baby and they just hand it to you and they're like, okay, go home. And it's terrifying. And I've never had that fear. Partially because I think you encouraged me to make my own decisions, Miri. But I also think I've luckily kind of like retrained so I do make decisions for myself. But that's a hard thing to do. And a lot of women and just people in general, until they work with someone that's encouraging them to do that, they may have never done that in their entire life. And that can actually, like, I've actually had clients get mad at me when I don't tell them what to do. And I'm like, no, you answer. What do you want to do? And they'll like get mad, or like when I don't give them a meal plan and tell them what to eat and how to eat and how much and when to do it and when to swallow. That's a little dramatic, but they like get mad at me. And I'm like, you're mad because you've never been put in the driver's seat.
Right. Yeah.
So like one of the questions we had for you, Miri, which I think plays into this perfectly, is like, is birth inherently unsafe? Because I think there is so much fear around it. And do you think, once you answer the first question, does a lot of the lack of education and autonomy play into why so many people fear birth?
Yeah, that's a two-part question. I think birth, my worldview and philosophy on birth is that birth works. Like we wouldn't be where we are today if it didn't, and it works most of the time. And so I feel like when you're pregnant, you're not sick, right? It's the only thing we go to the hospital for that's not a medical event. Having a baby is not a medical event inherently. Yes, there can be complications that come up. Those complications typically for healthy moms are very rare. So when I think about the birth process, it's like falling asleep. Your body just does it. You don't know how that happens. You just lay down in bed and your body does it. And that is the same thing with childbirth. I always tell people eventually those babies will come out of you. Yeah, like eventually that's going to happen.
Yeah.
Um, so to me, I believe that birth is not inherently dangerous. And so for a lot of these women, when they have all these stories coming at them about, oh, I was induced and I had to have an emergency C-section, a lot of that is just, I hate to say the word misinformation, but when you get down into the nitty-gritty of most of those birth stories, that C-section was never an emergency. I personally have never seen an emergency C-section, even after all my years as a doula, and I had quite a few C-sections, but none of them were true emergencies. And so an emergency C-section is so, so rare. So I feel like people are just being bombarded with all these stories and these fears, and it yeah, people feel like a patient when they're pregnant. They're like, oh, aren't you going to do something about this? And I'm like, no, you're just going to cook a baby and then you're going to push it out eventually. Like that's
I think that's what culture and social media and all this stuff has just like taught us that. Like you get pregnant, you pee on a stick, you get a positive test. Oh, call your doctor. Get
yeah.
your first appointment scheduled. And then it's just this like structure of going on this week, going on this week. And it's like you go in, and I talk to girlfriends, and a couple of my sisters are like pregnant and stuff. And like they'll go to appointments like I have no questions at all. Because they're just kind of waiting to receive information, right? But they don't go in because they're not, a lot of us aren't taught to ask questions and do research and get educated and all that before we go in. We just rely on the system.
Well, I think back in the day when we had, I know we want to get educated now because there's so much of the other side of it. But back in the day, we didn't really have a lot of education about birth. We just knew our mom's birth stories and our
Mhm.
sister's birth stories and our grandma's birth stories. And so, and back in the day, we didn't have all of these medical interventions. And so generally, you just hear of women having babies and you just know, oh, it's going to be really hard and it's probably going to be painful, but like all these people did it, I'm going to do it. And there's just like, that's it. Like, there's just like this unspoken knowledge that they're just going to be able to have a baby and it's going to be fine. And there's not a ton of information. Like, I think about like Little House on the Prairie times. Like, those people they didn't go to childbirth education classes. They just had a baby,
Yeah.
right? And they had a community doctor or midwife or someone that showed up towards the end. You have to realize the prenatal schedule is pretty new. Like we came up with that. And it wasn't that we found that the prenatal schedule kind of prevented any bad outcomes. So back in the day, you only really ever started seeing a midwife closer to term, and really all the things they did was like check your urine for protein and your blood pressure to make sure you weren't developing preeclampsia. And that was like kind of their main job towards the end as far as prenatal care went. And then because they weren't getting all these ultrasounds and stuff, and then they were there for the birth and postpartum, right? So then when they looked at the study of the more prenatals, they found that women were happier with that. And it wasn't that it caused any better outcomes. It was just that women liked it better. And I think that that's because they were getting to know the person more and it was like they were seeing that person more. But the modern prenatal schedule isn't really evidence-based at all. And so like I think yes, education is really important, but I also think back in the day we didn't even have that much education and we were still fine. Like it's more that we have so much fear injected into our brains now surrounding birth that now it's like we have to re-indoctrinate ourselves with more education about how birth is a pretty physiological normal thing so that we can kind of reassure ourselves when we get inundated with all of this like fear information that that's not necessarily how birth goes or how it really is supposed to go.
I love how you just talking right now, Mary, is just like going through our entire outline, like on your,
Yeah.
you're literally answering everything so beautifully with like no prompting. I'm like, dang, girl, is amazing.
This is why I wanted to have her, because I was like, it's gonna be great.
Our question literally says, what happens when we reframe birth as a transformative experience versus medical event? And you like literally just answered that. I do want you to explain a little bit though, what you touched on, the importance of mindset and trusting your body around birth. Like what difference does that make when you do see your clients that can start having autonomy and trusting their body? Like what does that shift do for them and their birth experience?
Yeah, I think I really focus on the fact that um, I really believe in their ability to make choices, and I think that's what shifts the mindset. Is that then they start to realize that they can have confidence in themselves. And I'm not just talking about their bodies, but like, which I think, but also their decisions when they're able to like cognitively be like, I'm confident in myself and my ability to make these decisions. I think that translates physically as well, to where you naturally then become more confident in your body's sensations and feelings. And I feel like that's what the mindset change, it really trickles down, is that I'm not like this patient, this inactive, passive person in the healthcare situation. I am the boss, the person in control. And I think that's what shifts the mindset away from being told what to do and the fear. Does that kind of answer that question?
Yeah, perfectly. Yeah, it's a really good explanation.
I was just thinking, like, shifting into you're not the one that it's happening to, like you are the boss. And I think that's so many people in our society, and then women in particular, like we're not used to being the boss in a lot of situations, and then especially even with our own bodies. And then I feel like that's kind of what led us to the route that we've experienced over these past, like really since I feel like when did birth care start to kind of change? Was that like 70s, 80s?
Oh gosh, I'm so bad with numbers, and I know
You're good.
about dates and numbers, and I'm like, I don't have that off the top of my head, but
Okay.
yeah.
I know it's less than 100 years for sure.
Well, because I know that there are still like grandmas and great grandmas that remember like the age of twilight sleep,
Yes.
all of that. So like it wasn't even that long ago.
Yeah.
We were knocking women out and pulling their babies.
That was my grandma. My great grandma was literally put under. And that
Yeah.
like blew my mind. She's like, yeah, I went to sleep and then baby came out. I was like, what?
Yeah. And like
It's crazy.
then it was all bottle feeding because the moms were literally unconscious. And so like formula companies were really able to capitalize on that. So the extreme medicalization of birth, people talk about how bad it is now. It was worse. It used to be a lot worse.
Yeah.
But that was not that long ago.
Yeah.
Crazy.
My dad this weekend just said, well, it seems like birth at least is getting better now. And I'm like, in some ways, like at least we're not strapping women down to the table and like knocking them out anymore. Like that's good. In some ways, it's almost a little bit more slimy, I'd say, or like a little shady, because I think coercion happens in like it's not so outright anymore. It's like a woman can go through her entire pregnancy thinking something's going to happen, and then once she actually gets into her birth and labor setting, things change, and care providers are doing things differently and stuff like that.
That's why when people are going to their prenatals initially, nothing is really happening because the baby is too small and premature for the doctors to do anything.
Yeah.
It's not till you get to term that all of a sudden people are like, whoa, what just happened? All of a sudden my doctor is starting to talk about induction and oh, I'm only 1 centimeter. And all of these things start coming up because as soon as you get to like 39 weeks, that's when a doctor can start doing things to you, right? They really can't do anything up to that point.
No.
Unless something is truly very wrong, like unless you have like severe IUGR or something going on to where it's very clear that some like an induction needs to happen.
Can you explain what that is, people that don't know what that stands for, Miri?
Oh yeah, intrauterine growth restriction. So
Okay.
it's like
Yep.
placenta's not giving the baby enough and they're not growing. And normally there's other pathologies that come with that, like someone who is not a healthy person smoking, or someone who has like there's preeclampsia is a big reason for that to be happening as well. So like preeclampsia and intrauterine growth constriction go kind of hand in hand sometimes. So up up to 39 weeks, people are just going, their appointments are very fast. They're like 10 minutes. Blood pressure check. Do you have any questions? Listen to baby. Okay, bye. Most doctors aren't even hands-on palpating anymore. They're just relying on ultrasounds. So like, they're just like, oh, I don't think I have any questions. And then all of a sudden, once the doctors can start doing something like checking them at appointments and doing membrane sweeps and like that, then it starts to turn into something very different from what they maybe were expecting. Because a lot, and we call it bait and switch. I don't know if you've heard that term, but a lot of times they come in initially and say, I want a natural birth. And the doc's like, yeah, we'll see. Yeah, sounds good. And then towards the end, that's when all of a sudden things can change just because they're able to at that point.
Yeah. Yeah, that makes sense. I think this is a really nice segue into differences between OBs, midwives, doulas, hospital, birth center, home birth. So I'd love you to chat a little bit about what is physiological birth, differences between OBs, midwives, doulas, who does what, why is it different? What's the like obstetrician obstetrician model of care versus like the midwife model of care?
Yeah. So like the midwifery model care is based on the idea that birth is not a medical emergency, that you're a healthy person, that birth works pretty well without us. Midwives are just there to support women and handle any emergencies that kind of crop up, some of the common emergencies that might crop up. So it's much more a belief that the hormones and everything work together and that birth tends to just happen and work pretty well most of the time. Um, and then the more obstetrical model, and you have to think about the history of it, right? So in the USA, it's very different because there's a deep history of distrust between midwives and doctors because they were like at war with each other because it was more of a profit thing for the hospital to try and bring women into the hospital to have babies. And so how the doctors are trained, and honestly, I'd love to just sit in on their like OB rotations and like what they're actually getting taught because so many doctors I've worked with are just kind of fearful of everything. And they believe that managing these births through Pitocin, you know, and like just being very managed and hands-on is safer. So the more kind of medical management we can do, the more control we can have over the process, the better. So it's kind of medicalizing a process that is inherently not very medical. You know, it's not an appendectomy that they can just come in and do, and that's it, right? It's a whole hormonal natural process. And so in their minds, it's something that they need to be able to control in some way. And this is a generalization. There's doctors that are going to practice more like midwives, and there's midwives that are going to practice more like doctors. But in general, and OBGYNs are surgeons, so they're good at surgery, and they feel in control in a surgical environment. You know, a woman screaming on her hands and knees is probably not something that they maybe are super comfortable with. I don't know how many doctors sometimes even see an unmedicated birth just because they are doing a lot of epiduralized births. And so that they're used to things just being set up the way that they've been doing births for a long time. And I've had, you know, OBs just never have delivered babies in any other position than like a mom on her back in stirrups. And so, I mean, that's not true for some of our local hospitals. The OBs are really awesome, but unless you've been exposed to that through your school, or unless you actually questioned it and been more open to different things, the OBGYNs, just through their training, not any fault of their own, are going to be thinking that more control, more medical interventions tends to be better.
Yeah, that makes sense. Could you talk a little bit about, we touched on it, but I really like the comparison of like prenatal appointments with OBs versus midwives, because I like midwifery, like you're with your midwife for 45 minutes to an hour every visit, where a lot of OBs aren't. And can you talk about that a little?
Yeah. Well, you have to think about how many patients they're seeing in a day. So that's why you get taken back by a medical assistant. It's a process to like get people out, because they're not looking necessarily to build a relationship. It's more like, let me tick the boxes because they're seeing so many people in a day. And that's really stressful on them. So typically with the OB, they're only thinking about this from a medical standpoint and assuming that all the things like your blood pressure isn't high and everything the medical assistant did, everything looks good. They're just popping into rooms just to like check a box and be like, do you have any questions? They also are going to be rotating calls. So it may or may not be your doctor that you think you're seeing. Normally it's a group. It's very rare that you have just one OB that delivers all their patients. Generally it's a big group practice. So they all rotate calls. So the person coming into your room when you're about to have a baby may or may not be the person you've been meeting in prenatals. Midwifery care is going to really vary depending on the midwife. Like certified nurse midwives are going to be a little bit more like OBs because again, probably working for a hospital where they're seeing a lot of patients in a day. So they may be trying to take a little bit more time, but in general, it's probably going to be pretty fast. And unless you have a lot of questions, they may or may not have the time to sit there and educate you, which honestly, it's a little bit hard for me too, because I'm like, I don't have the time in a clinic day to do childbirth education with everybody. Like that, I feel like people are so unaware of like all the questions they could be asking. It can be almost difficult to bring those up in prenatals. But in general, I think midwives try to sit with women and ask them about their lives a little bit more, try and get into who they are as people. I know I really like to try and figure out what's your worldview behind the decisions you're making, because that helps me understand where you're coming from as a person. And so just getting to know people on a deeper level and seeing more of a holistic, bigger picture. I know like for me at least, I always like delve into like pelvic floor physical therapy and all the things I know that could possibly come up for women, trauma. In my forms, I have that in there so that we can, because I know things come up for people during birth. And so it's more looking at this person as a whole and knowing that every experience in their life is going to kind of be in like influence the journey that they're having now during pregnancy and birth. The other thing is that midwives are more autonomous, so we're not just checking boxes. We're definitely looking more into alternatives. So like using a tincture or an herb to start with, and then going into something more like a prescription is kind of the last resort. So we're trying to do more holistic options before we're getting to a prescription. We're also trying to really lay a foundation of good nutrition because we believe that that is the building blocks of a healthy pregnancy. And so there's more, I definitely do a lot of nutrition advice and stuff during prenatal. So it's a lot more well-rounded just because we're looking at the whole person.
I think
And
like
this is more midwives outside of the hospital, correct? Like midwives inside the hospital, do they practice similarly, or do they often go more prescription, like more doctor practicing?
They're very much under the thumb of the doctor
Yeah,
because
okay.
they have to practice underneath the OBGYNs.
Okay.
And so sometimes I've even seen midwives, CNMs be more interventive than OBs because they're nervous of what the OBs might say if this blood pressure is just a little bit too high. So they're very much wanting to check the boxes to make sure that they're falling within what they should be, because they do not have as much autonomy as I do. And that's why I never wanted to go down the CNM route.
Yeah.
I just knew that I was too much of a rebel. It would never work out. I'd get fired in like 5 seconds.
You'd be like, I don't want to do that.
you need your own autonomy.
Yeah.
You said no, so I don't know what you want me to do.
Yeah.
One thing I was gonna say before we jump to our next one is I always think of OBs as like, and not all of them, but my like generalization is it's more like put out the fires and they see like the belly. That's what they see. They see the belly. Versus a midwife is like the whole person. And it's not just like, let's put out fire. That's much more even like preventative and education and connection and all of that. And that's just based on the systems, like the medical system versus, more of like the setup of what you have with your clinic. It's just very different.
Yeah, I just have so many people coming into care that have maybe had preeclampsia with their first baby. Preeclampsia generally is just hypertension, and they were induced, and they get told, okay, the thing that you can do preventatively is a baby aspirin, and like that's really all they're getting, and no one's looked at their diet log. Nobody's looked at their supplement routine, like, because that's not taught in schools. I mean, I had to research that myself. Like, it wasn't even really in midwifery school. Like, so it, a lot of that information is not accepted medical advice. So when I'm advising people about like nutrition and supplements, I'm not following anything that, anyone would get any information about in medical school.
Yeah.
I mean, they get barely any nutrition, like their nutrition education is like nothing.
Yeah. Amber, didn't you have a client who was pregnant with twins and she asked her doctor if she needed to do anything different with her diet? And he goes, oh, you can just double up on your prenatal.
Mm-hmm.
And she told me that, and I was just, and Miri, like, yeah. And I was just like, no.
I was like, I think this is a no-no. Well, I did the same thing, Miri, around like exercise and pregnancy and postpartum. Like, I've had clients be like, I was told this in my own prenatal, don't twist, don't lift over 10 pounds. And I'm like, just the things that women are being told. And again, it's not that the providers are trying to be, what's the word I'm looking for? Unsafe or give bad advice. They just don't have the education unless they've gone out and sought that education themselves. They're not trying to be malicious. That's what I was looking for.
Yeah. And I think it's more like you either are mainstream, and that's why I try to like look when I do consultations with clients, I'm trying to figure out, is this someone who wants mainstream care? Do they want mainstream advice? Do when they get a headache, do they take ibuprofen immediately, or are they like using peppermint essential oils and cold packs on their neck and taking a like homeopathic? Those are the people that are going to do well with midwifery care. The people that are like just give me the ACOG recommendations, that's what I'm looking for. You're going to do great with an OB. Like, you're just not bent towards alternatives. And so, unfortunately, I think midwifery care is kind of like more of an alternative. I wish people didn't see it that way, but I found that I align a lot better with people that are wanting to really not do everything by the book.
I think it's a great.
I mean, I feel like that's Amber and I.
Yeah,
like,
you explained
literally,
that so
it's like we're alternative, and we're like, why are we alternative? Like, this is diet and like movement. Like, why is this alternative? But it's alternative, which is frustrating.
Oh, because there's no study. Like when I do give my recommendations, I'm like, just so you know, there's no study on this. Like, I can't just hand you a study and be like, because where do the studies come from? They're funded from pharmaceutical companies, all of that. And hospitals fund studies. Like the ARRIVE trial was funded by a study that was for induction. And that was a whole study that came out that showed that induction was better than waiting. And that was all funded by hospitals that had vested interest in inducing people. Inductions pay way better than just some woman coming in about to have a baby. And there's major conflicts of interest that just happen within the
Totally.
I think once you start like opening your eyes, you're like, oh my gosh.
Johanna, and always say you can't unsee what you've seen. So like once the veil's been lifted, it's just like, whoa, what is going on?
Yeah. It's scary. And then you see it how it's like in everything. It's not just like, it's like once you learn about food and then you see big food and then you learn about birth and then big birth and then like big supplement, and it's just like, oh my gosh, it's crazy. Okay, would you break down hospital birth, birth center, home birth? Because I know personally, I was like, in the beginning of me learning about this, I was like, oh, I don't really want home birth, that seems too scary, but I'll do birth center. And then one of my best friends is like, oh, midwives bring the exact same thing. So do you mind explaining like what they are and then why someone might choose one of them versus the other?
Sure. So hospital births, obviously the main things that they're going to have, and this varies state to state, so you're going to want to check in with your state, but at least in Washington, we carry all the same hemorrhagic medications that the hospital has. The only thing we really can't do is rush someone back to the OR for like a D&C or if it gets to the point where they're needing a blood transfusion, or this is like a massive hemorrhage where we need to be in the OR giving blood. That is a situation that obviously the hospital is going to be able to handle. I can't handle that. The other thing the hospital has is the NICU, right? So if a baby needs the NICU, I don't have the ability to provide NICU care. If a baby needs more respiratory support past initial kind of neonatal resuscitation, then that baby needs to be in the NICU. So obviously, I don't have an OR, so I can't do C-sections. Another thing we can't do is we can't do inductions with any kind of medicine. So we can't do inductions with misoprostol or Pitocin or anything like that. Our only options for induction would be like the herbal things, castor oil. Sometimes if someone's dilated enough and it's not their first baby, you could try and break their water and just see if that got things going. Don't love that, but that's like an option. And then there's also like mechanical induction that we can do, which is like the Foley balloon where we can put in like a Foley, and that puts pressure on the cervix and that can mechanically dilate the cervix so it can kind of get labor kick started. So those are kind of the major differences between the hospital and a home birth or a birth center. And as far as the differences between a home birth versus a birth center, there's not a lot, honestly. I always say there's an uncomfortable ride there and an uncomfortable ride back for birth center. And I know that's not a big pitch for birth center because I only really do birth center, but one of the main reasons I think that people choose birth center is because it's typically in town and closer to a hospital. And so people that are super rural or just don't feel like they're close enough to the hospital, it can be a good in-between option. Another reason I think birth centers can be really nice is that you don't really have to worry. You don't have to worry about setup. You don't have to worry about cleanup. Like it's all kind of there, ready to go. And for some people that have a lot of other kiddos, going to a place where it's not your home. I see women not like trying to play host, which can kind of slow down their labor or stop labor. Because when someone comes into your home, a lot of times you all of a sudden feel like, at least I think a lot of moms do, like, oh, do they want something to drink? And oh, is my house tidy? And like, there's that feeling of playing host, which isn't the case at a birth center. So I've seen it take a lot of stress off of moms. So those are kind of the pros and cons of those. But as far as home birth and birth center, as far as the medications and the things that we carry and bring, it's pretty much the same thing.
And I know someone's going to be like, okay, all that sounds great, but what if, and that's why I'm choosing the hospital birth, because what if I do hemorrhage? What if I do need to be induced? Whatever that might be. From my understanding, a lot of those things, a midwife can identify if you need that and you could transfer to a hospital and still get that, correct?
Yeah.
And very rarely is it truly an emergency. You need it right here, right now. But correct, much more than I do on that, if you want to elaborate on that.
Yeah, so the what if scenario, I always kind of go back to accepted risk. So we have become a society that has no acceptable risk for a mom and a newborn. Like the hospital is the place to have a baby. It's the safest place that's drummed into us. And so the idea that someone would die during childbirth or that the baby would die during childbirth is unacceptable in our society. People don't realize that moms and babies die in the hospital too. And so the culture is very much, if someone had something go wrong at a home birth, that their family and friends are not going to be very sympathetic. Why didn't you have your baby in the hospital? Well, if you just had your baby in the hospital, this wouldn't have happened. So there's an unacceptable risk there that people feel pressured by. What most people don't think about is that when you start thinking about culturally acceptable risk, every time you get in your car to drive to work, the risk of you dying in a car accident on your way to work is probably higher than the risk of you dying during childbirth at a home birth with absolutely nobody there. Like the risks in a developed country to die during childbirth or have something horrible happen to you are very, 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 very small. Like it, and that's just statistically, like you can look it up. Like it's, so to me, it's about where you feel safest. And so it has to be individualized. Like, I don't think people should have home births if they don't feel good about it, if they don't feel safe in that environment. But if you're just looking at it from a logical standpoint and a risk assessment standpoint, if you are in a state where midwifery care is well integrated with the systems and there's good midwifery laws, like I said, I practice in Washington and we have great stats. Statistically, there's no difference as far as outcomes goes for mom or baby, for a hospital or home. So just from a stats point of view, it's not logical to say that, it's not evidence-based. It's not supported by evidence to say it's safer to have a baby in the hospital, as long as you don't have a bunch of complications. And as midwives, that's what we're trained to do. We're trained to look for those times when it would make more sense to have this baby somewhere where there is an NICU or where there is an OR down the hallway. When we are thinking about induction, that's another risk assessment. We're always checking to make sure that this mother is staying low risk the entire time they're in our care. And then when it comes to the birth process, we're also assessing all those things the whole time, and postpartum. But midwives are trained for those. I've managed not lots, thankfully, but I've managed hemorrhages and not had to transfer them because I have the ability to do that. I have a skill set to take care of parents with those initial emergencies. So hemorrhage, neonatal resuscitation, I can suture up to a 2nd-degree tear. Those are all things that, is in my scope. I can handle a shoulder dystocia, and honestly, I would prefer me handling a shoulder dystocia than some OBs I've seen. So when people say, what if? In my perspective is, I would prefer a home birth because of the way midwives handle emergencies.
Yeah.
Like something that's very evidence-based is keeping that cord intact while you're doing a resuscitation. We have way better outcomes with that versus cutting and clamping and moving the baby to the warmer right away. And I just think that that's never going to happen in the hospital. So it's that kind of.
Yeah. Well, and I think with the hospital, unfortunately, because they often manage birth, there's more interventions, and more is not better in something that innately works. Not always. Sometimes it might be, and it might be warranted, but a lot of the times it's not necessarily warranted, but it's happening. And then there's a term called the cascade of interventions, where like being induced can lead to an epidural, which can lead to C-section. It's because you're starting to mess with something that does innately work. And I think and then you'll have the emergency C-section where then people say, thank God we're in the hospital, right? And it's like that almost like self-fulfilling prophecy, or like a really like it fuels itself of then people think, okay, thank God my body couldn't do it, I needed to be in the hospital. And maybe some situations that's true. But I think that's something that a lot of people, when they think about the what ifs and the risks, is they're seeing what births look like on movies, which isn't very accurate. They're like hearing stories from family, friends of like, oh, my C-section was necessary, I couldn't do it without it, or whatever it might be. And it's like, that may have just been the story that was told, but it may have not actually been the full truth in that situation.
True. And I think it's hard because it's almost easier to believe. I mean, think about it from someone's perspective. They went to the hospital where they trusted those people and they trusted them to take care of them for emergencies. And some things happened and they were told, you know, you need this C-section or whatever it is. And they were like, okay, we're doing this. And then they come out of that feeling kind of blindsided, but then they have a good reason for it. Like, say they were told the cord was wrapped around the neck. That's something that I feel like is a scapegoat. Like, a lot of times doctors will just pull something out of the hat to like give them a reason for it, right? And then they might just be scrolling social media a few weeks later and see a post about how 1 in 4 babies have their cord wrapped around their neck, or 1 in 3. I don't remember the exact statistic, but it is a lot of babies. And all of a sudden their world is like shaken up a little bit. And it can be really hard to come to terms with the idea that something happened to you with people that you trusted that maybe wasn't necessary. And that can cause a lot of PTSD for people. So when I think about it, I have a lot of compassion, and I sometimes don't bring things up for people. I wait for them to kind of tell me their perspective on how things happened before I bring up anything, because I don't think it's necessarily helpful all the time. And some people aren't ready to kind of delve into why things happened the way they did. And they're just happy with the knowledge that the people that they trusted took care of them, and this was the outcome and they felt good about it. I'm not going to destroy that bubble that they're in, because even if I think that that wasn't necessary, from their worldview and perspective, it was. And so I just kind of wait to hear back on how someone perceives something. Someone comes to me and says, this happened, I feel really traumatized by it, then I can kind of delve into it. But if you hear a story of someone who's like, oh, I was induced and the reasons seem a little sketch, and then, you know, they had a really difficult birth, but they feel good about it, like they feel like it was necessary, I don't really say anything, because I think it can be very traumatizing to try and think that, oh, all of what I went through may or may not been necessary.
Yeah. It's like they almost need to come to terms with it on their own in that type of situation, which makes sense.
And some people never will, and that's okay. Like, I mean, I think it's like lived experience and perspective is really important, and I'm not going to be the one to change that for somebody. I believe that how you view things, I want to validate that. Like, if you felt really good about your care, even if I don't agree with how that care happened, I'm going to validate how you felt about it, because that's what's important to me, not that I try and push my narrative.
Yeah, I love that.
I love that a lot. Okay, awesome. We want to jump in to finish off this episode. What are a few things that you would recommend of how to be prepared, or how to prepare yourself for an empowered birth? Like, do you recommend books? And I know it's probably going to depend on the situation, but books, movies, education, or none of that and just kind of tuning within, what would you recommend?
I think, first of all, people need to figure out their perspective on birth, like, and where it comes from. So that's something that I always did as a doula. I would sit down with people and try and figure out, again, which way they were leaning. Were they leaning more mainstream, ACOG recommendations that gives them safety, security? They're looking for their doctor to really kind of tell them what to do, and they're not ready to be all alternative, right? And if that's the case, if you're more feeling safety in doing, you know, ibuprofen and more of that type of care, and thinking about the hospital as a place that brings you safety and peace, then I would say that really what you need to be thinking about is how to not come out of your birth traumatized. And I know that really always my goal for people is to come out of their birth being emotionally and physically whole. And I think we talk a lot, like we see those things like mom and baby need to be healthy, yes, but I believe that you can come out of your birth emotionally whole. And I see in the hospital, okay, so say you want a hospital birth and you're like, yes, that is me. I want to follow ACOG. I want to do all the things. Like, I want to go to my OBGYN and check the boxes that they recommend. I'm really comfortable with that. Say that is you. what I see the problem with that being is that during a birth experience, we're not talking about process that is not incredibly emotional for women. This is not a medical procedure. And so, as far as vaginal exams go, we're dealing with very intimate parts of the female body, which a lot of people have history and trauma history with. And so, what I want those women to think about is how are you going to have an advocacy plan in the hospital, because it is not routine for them to be asking consent. And I do think that that is changing, but how are you going to keep yourself and your emotional health safe through a birth where maybe you have a doctor that just comes in and puts on gloves and is like, okay, I'm going to check you, and you don't feel like you are active in that, like saying, yes, I would like that, or no, I don't want that. It's the same kind of thing. I equate it back to like sex. Like you have to feel like, yes, I really want this, or no, I don't want this. And you can't be in between and be like, well, I guess this is just happening to me, because that can really re-traumatize people, especially people with like a sexual abuse history. And so the number one reason that they found through studies and polls for women that felt traumatized to their birth, and that is a very high statistic, is that they felt that there was no communication happening with their provider and they felt out of control. Those were the two main reasons that there was trauma during birth. And so ways that you can kind of mitigate that, I do think if you don't have any options, then you can't be an active participant in the birth process. And so I do think getting some good education is important. So taking a good childbirth education class, and one that's well-rounded, that's not just talking about, there's a lot on social media right now that's like, epidurals are terrible, but one that's like really giving you all your options in a very grounded way, and not like saying one thing is better than another, but this is just your options. So just like a well-rounded childbirth education course. A great doula is so important, and I think that they are like really the people that help with the conversations. So sometimes that communication isn't happening, and the doula can help facilitate that communication, especially when you're in a vulnerable place and you're in labor. It can be hard to, and your partner may or may not know how to start those conversations or have them. They're going through this new experience too. So I think it's a lot to put on the partner to be like, you're going to be my doula. And when they're trying to like, this is the first time they've ever maybe experienced this. So a good doula, and when I say a good doula, I do not recommend doulas that say things like, I'm not going to be speaking for you. I'm not going to be doing anything other than like rubbing your back and stuff. Because, okay, if you want someone there to just rub on your back, cool. But most of the time, you are going to want someone who is able to facilitate communication between your care team. And I would say that's why most parents hire a doula. The gap happens when parents don't realize that doulas often get trained not to talk to providers. And then there's this like kind of mismatch in expectations. So I would say when you're interviewing for a doula, definitely be asking them, what are you going to be doing for me at the birth? Do you have an advocacy plan? I want to shout out Tracy Doula's advocacy program. She has a fantastic advocacy training for doulas. And so definitely look out for doulas that have done something like that, so that they can facilitate those conversations, building the team during the process. And so that even if you're like, yes, I want like induction at 39 weeks or whatever it is that you are wanting, it is your choice. You do not feel coerced into it, and you are getting to stay in control of your body. Because I think that that's super important for women, no matter which way you lean. I don't think, it kind of makes me mad when we think about women only getting their way and what they want when they choose a midwife. I don't think that should be what happens. I think everybody, whether they're going in for a scheduled induction or whatever, should feel in control of their body and their babies and the process of it all. So I'm really passionate about that. So I believe that a great doula with an advocacy plan and a good childbirth education course is probably the best thing I can recommend for that.
And I probably for either situation, hospital, home, or birth center, because you could get transferred to the hospital, or even you might think that you're super on board with your midwife and stuff happens and the doula is there as like a third party to help be the liaison too.
Absolutely. Yeah. I think that you hit the nail on the head. I believe that that's true for every woman trying to figure out like what should I do? You know, I'm pregnant, where should I go? So once you figured out where you lean towards and you're like, no, maybe I am much more like naturally minded and I do want to be more out of the hospital environment and I do want to work towards an unmedicated birth. I would say it takes a little bit more of someone who wants to take a lot of personal responsibility just because unmedicated birth is hard. It's like a lot. Like it's not easy. I'm not saying that the epiduralized and stuff is easy, but it can be overwhelming how much intensity and everything is happening. And so I do think it takes a little bit more research on that person's part to figure out, okay, because again, you have to feel really secure in your decisions because a lot of people are going to get kickback from friends and family on it. So you want to feel secure in your choices. And then trying to find a midwife that aligns with you, I think is really important. Knowing what you're comfortable with and what you're not, as far as maybe going past 42 weeks, what the laws are in your state. Some midwives can't deliver past 42. And so you're kind of trying to mitigate like the bait and switch with midwives because you don't want to come into care with a midwife and be like, well, I've heard midwives are just great and I'm going to get to make all my own choices. And then that midwife at 42 weeks is like, okay, I'm transferring you out now. Like that can really cause trauma as well.
Yeah.
Also, like, are you comfortable with having a breech baby if your baby stays breech and does your provider deliver breech babies? Those are some of the things I can think off the top of my head. How hands-on is the midwife? What is she going to be doing in the room when you have the baby or when you're in labor? How does she like to be communicated with during the process? What kind of education are you going to get in prenatals from her? And what do you need to outsource elsewhere? Like, what are her emergency protocols? That's something that I think is super important to ask because midwives can be great. Like they can be really sweet and kind. But if you don't have a midwife that knows how to resuscitate a baby and you have a baby coming out looking a little scary, that's what you hired your midwife for. She should be competent in that. So you should be able to ask about her emergency protocols and she shouldn't be blowing them off and being like, well, that never happens. Or, well, we'll cross that bridge when we come to it. No, no, no. A midwife should be able to list off the reasons she would transfer you, what the warning signs are. She should also be able to list off like her neonatal resuscitation steps, what tools she has, what she would do for a hemorrhage. She should be able to tell you all of that in a consultation, and there shouldn't be any hesitation. And again, there's a lot of like these unlicensed versus licensed talks right now amongst midwives, and especially on social media. And I don't have a problem with unlicensed midwives. I think that there are plenty of them that are like have been well trained through the apprenticeship model. I think it's more about figuring out how confident they are in their answers and figuring out what are you going to be able to do for me during birth? Do you know normal? Do you know not normal? Do you know, can you list the reasons that you would transfer me? And then if you're hearing her reasons and you're like, I don't really jive with that, or she's listing the reasons, or she won't even list any reasons, those would all be red flags. So I would just not hire the first midwife you interview and really figure out where you align and where you don't, and find the person that's going to be a good fit.
Well, I just want to thank you, Miri, for like your heart and your passion because you can just like hear it in your voice when you're talking, and it just makes me so excited for your current clients, for your future clients, and just if people don't follow her on social media, we will put it in the show notes because her stuff is hilarious and you can feel her passion in that too. We want to respect your time though, Miri. So I have one final quick hitter question, and then we're gonna let you peace out. So I know you got a call to get to. If you could give one last piece of advice to the women listening, what would it be?
It would be, you're powerful. You have everything within you to make all the best decisions for yourself and your baby. And I just want women to see that power that's inherently in them. I often hear the word empowered, and I always go back to, it's already there. I don't need to empower you. You have it within you, and I just want you to see it because it's there. So you have the ability to make the best decisions for yourself and your baby. And I want people to know that you can find care providers that trust you to do that.
Love that. Like, give me like chills.
I'm starting to tear up. I'm
Really,
gonna
so
blame
good.
pregnancy hormones.
Yeah, so good. Well, Mary, we can't thank you enough for coming on here. We've been so excited for this episode. So we'll put all of your contact information in the show notes. People can reach out to you if they have questions and follow you and all that good stuff. But yeah, we so thank you for being here. It was
Well,
amazing.
thank you for having me.
Absolutely.
Thanks so much.
All right. Well, I hope everyone listening got as much out of that as Johanna and I did. Miri's just literally a wealth of knowledge, and I already said it, but listening to the excitement and the tone and just passion in her voice, like gives me the chills. And Johanna and I were talking before we started filming this. I try not to play the what if game with my births, but I said if I had met someone like Miri before my first pregnancy, like to think about what my birth could have been, because so many of the things that Miri talked about was like like the more negative stuff was like my story. And so in some ways it's almost healing for me to hear the other side of birth and like the beautiful side. And yeah, I just hope all of you took something absolutely beautiful out of this. Because birth can be beautiful and amazing and physiological. And I don't think there's a right or a wrong way to birth. Like you truly do have to follow your intuition and your heart around what you want from your birth. But yeah, I hope you guys love this as much as we did. I'm gonna kick it over to Johanna. I want her to share a very beautiful quote that she sent to me right before this. So I'm gonna kick it back to her.
I'm gonna do both because I just love both of them. So I read these. One of them was in a meditation that we'll link in our show notes, and then the other one was in a birth book that I'm currently reading called Birthing from Within. It's actually a book that Miri recommended to me, and it's all about like trusting your body, trusting your power, and trusting like our ancestral wisdom as well. So the first quote is, and I'm going to use the word surges instead of contractions. Your surges are not more powerful than you because they are you. And to me, that just like gave me chills because contractions and when I haven't gone through birth yet, and when you're thinking about that, it's scary. Like, because you hear about like people like, oh, it feels like my pelvis is splitting in half, or like it was so intense, or like we have so many medicated births, and my goal is an unmedicated birth that it's not something that I'm afraid of, and that's why we wanted to do this episode. Is I'm not afraid of birth personally. I think it's because I've done a lot of work with it, but there is that uncertainty of like, man, this might be really strong, and I hope that my strength can meet it. And I read that, and your surges are not more powerful than you because they are you. And I just thought that was so cool that it's an internal source of energy. Um, and then this other one, this was a quote from the book that I was reading, and this really helped me. I'm a very heady person. I can get into my head very easily. And it's a little poem that says, and that giving birth is something a woman does in her body, not in her head. And I thought that was really, really cool. It just shows that we have innate wisdom within. And oftentimes we do just need to take a step back and allow ourselves to know what we want. Ask ourselves, what do we want? Ask yourself, like, if this were to happen, what would I choose? How do I want this to go? Because you, like Miri said, you are the boss of what's going to be happening. It's not going to be happening to you. You are the boss. You're in control. So we wanted to leave that there. But yeah, I love her. She's great. I hope that you guys really gained a lot of information from this. Amber and I were just talking about like maybe we'll do a part 2.
I think we should. I think part 2 needs to be done because there's a lot more we can nerd out on.
Oh yeah, there's so much. We had an outline for this episode and we covered like half of it.
Yeah.
So we have a lot more.
We do.
Awesome. All right. Well, we will see you guys next week. Love you all and hope this is helpful. We are going to put resources in the show notes as well of books, films, podcasts, meditations, and visualizations as well that you can do. All right. See you guys next time.
That's a wrap on today's episode. Thank you for hanging out with us on the Wild and Fierce podcast. If you loved this conversation, we'd be so grateful if you left a review and shared it with a friend who needs to hear this.
And if you really loved it, take a screenshot, share it on your stories, and tag us. We'd love to see it. Until next time, stay wild, stay fierce, and keep owning your journey.